Okay, so this is a technique that I found very, very useful for patients with psycho-emotional problems. Uh, I was taught that it was called Dingfa, and the translation I was given was stabilizing method, or stilling method, or something in that vein. This was taught to me by a professor of mine at school. Unclear whether this was his own sort of empirical practice where he found this technique or developed it, or whether it was from a classical source. He was not particularly diligent, this professor, about his attribution and citing his sources, so we don't know. But regardless, the important thing is that I've found it quite effective in helping these patients. So I'll show. This is usually done. I've really only, except for a couple of very specific cases, I've only ever used it on the lateral back shoe points, the lateral bladder line there. The points named for the 5 the 5 minds. Okay, so insert the needle as normal. Obviously, we're using the angle and depth of insertion that are going to be safe in the thorax. So the really important thing with this is the breathing. So I'm going to describe it first and then I'll demonstrate it. All right, so you're going to start by breathing as though you're having a panic attack. So you're going to start, and the placement of the breath is important. So you begin kind of in the upper jaw. You're doing that kind of cervicothoracic breathing pattern that we associate with anxiety or stress breathing or sympathetic nervous response. And then you're going to gradually slow the breathing, and as you slow it, you descend to the lower dantian. So I'll demonstrate. So you're going, and the idea is I was taught it with a slight lifting and thrusting motion here with the needle that goes in time with the breathing. But I've found that you really don't, or at least I really don't need not a very big amplitude on this thrusting. And of course, we do want to be careful here because this is the thorax, and we don't want to be giving anybody a pneumothorax or anything like that. So I really find that just the motion transmitted through the needle with my breathing is sufficient. So I guess you can experiment and see what works best for you. All right, so I'll demonstrate. So it's nah, I'm not doing it right. Hold on. Take 2. So okay. So you notice that last long breath, I find it helpful to think of it as a sigh of relief. All right, just okay. And at that point, you hold the needle in stillness at the point. Okay. So your goal, we're starting rapid. So So that's Dingfa, or whatever it's really supposed to be called. All right, so I hope that helps your patient.